Hi everybody, it's Monday, March 16th. I have a few follow-up questions and details about coronavirus in our office. First and foremost, I know a lot of businesses are changing just because of the circumstances now. We will not be performing non-essential exams, so just well checkups we'll postpone for the next few weeks. We will still see babies and small infants for checkups. We will be doing vaccinations and boosters, but nothing elective. So wart removals, ADHD checkups, we won't be doing that stuff. We'll delay that out a few weeks. Sorry, no candies, no suckers for the kids. I know it's unfortunate, but we have to do what we have to do. I know a lot of you mean well. Please don't send me any more recipes to kill coronavirus. Okay, they have no medical evidence. Gargling with herbs does not kill coronavirus. The combination of baking soda and olive oil you rub all over your body from Grandma Millie's 1910 recipe book does not work. I'm sorry to tell you that. And I'm not going to disseminate that information to everybody else. This is bad and terrible, but it's also very simple. And there are three things that kill the coronavirus that we know of. Alcohol, more than 60%. Peroxide and bleach, which we are primarily using here in the office. So wash your hands with soap and water, use hand sanitizer, disinfect objects with those three things. The other thing I want to touch on is let's not get a false sense of security or complacency about children. It is not true that if children get this infection or this virus, they don't get sick. It is true that a very small percentage of them are being infected and affected. It is true that they can be vectors. In other words, they can carry the bug without getting sick. But someone is infecting them if they're vectors. They still are being infected. So please keep them away from people, the kids, keep their hands clean. Also, it is unclear at this point in time how this viral illness will affect our fragile children communities. Prematurity, heart defects, chronic lung disease, kids with tracheostomies, kids that are vent dependent, kids that still need stomach tubes to be fed. You don't know how that's going to affect them, so don't get this false sense of comfort that the kids are going to be fine. Another question was, what's going to happen with the schools? So we're here in Ohio. Our schools are shut down as I think probably 2/3 or 3/4 of the country. Will they open up in April? We talked previously about a rise in the graph. So if it's steep, like a sharp mountain, that means a lot of cases in a short amount of time. If we can flatten that curve so there are fewer cases spread out, it would be a good sign. If in the next week we see a very sharp rise in a continuum, it would probably be unlikely that school would be reconvened if we're still on an accelerated infection course. But hopefully that will not happen. The other thing somebody asked is if they were exposed to someone with COVID-19, meaning they have the infection and that person ended up getting sick and diagnosed with COVID-19, how long after that exposure would they show symptoms if they were to have COVID-19? And that ranges from 2 days to 2 weeks, but generally the average is 5 days. So if you're exposed and you will get sick, generally it's about 5 days. Okay, that's all the details. I can tell you right now, I'll follow up in the next day or two with more specifics. Keep the questions coming, but not the homemade recipes. Try and stay healthy. Thanks very much. Bye-bye.